Dr. Sharda Jain. I'm Dr. Sharda Jain. I'm a gynecologist, an IVF expert, and expert of regenerative medicine and anti-aging. My question to all of you is, are you afraid of getting old? I know the answer is yes. Whether you speak loudly or you keep it in your heart. Because aging has no mercy. It is inevitable. This is the biology of aging. A child is born, and then this is the cycle. The genetics contributes nearly 20% to the aging process. And epigenetics, which is environment and lifestyle, contributes something like 80%. Everybody wishes to be age gracefully. And as an ambassador of stem cell therapy and a strong advocate of changing the lifestyles, my purpose of the talk is to make you aware about that these are the two gifts if you want to slow your aging process. What we have seen that people spend a lot of money and have an expensive holiday. But when it comes to changing their lifestyle and doing something like stem cell therapy taking, they have reservations. The content of this third talk on anti-aging in the last 10 years is that I'm going to talk something about science behind the aging and how the genetics and epigenetics contribute to it, and give you the management tips as I see as anti-aging expert. Aging has nearly universal impact on our bodies, affecting our cells, tissues, and every organ of the body. The effects of aging can be seen in everything, from our vital signs to our skin, to our bone and joints, to our heart, digestive system, nervous systems, and beyond. Till recently, we thought only women have problem of menopause. But andropause is also a very distinct entity. When the gentleman notices a change, lack of focus, low energy, loss of muscle mass, decreased motivation, and things. Scientists are working hard to find genes directly associated with age. Specific gene combinations determine the lifespan, and scientists do say that identifying longevity genes is very complex, not as simple as genes picking up a gene for height, obesity, and hair color. Epigenetics majorly contributes to aging process along with genetics, which contributes something like 20%. And it brings about alteration that cause a decline in stem cell function, and which brings about the aging process, whereas diseases like metabolic and degenerative diseases, which individual can have. As for the role of stem cells is concerned, and all of you know that these are the special cells, God-sent cells, who repair, responsible for cell renewal, regeneration, and rejuvenation. But we also know that increasing age, the functionality of the adult stem cells declines and genomic mutations accumulate. And these lead to impairment in regeneration and repair, organ dysfunction, and hastening of aging process is brought about as a result of the same. As to the role of telomeres are concerned, They're just like tips on the shoelaces. Each time a cell divides, the telomere gets shorter, and when it gets too short, it falls off and the cell dies. And then the ends will put fuse of the chromosome together and corrupt the cell genetic blueprint and possibly cause malfunction, onset of diseases, cancer, and even cell death. We all know that the cell normally divides only 50 to 70 times, and the shorter telomeres are associated with shorter lives. A lot of science work is getting focused on the metabolism. We all know that the metabolism gives energy, which is responsible for doing all the actions in the body, like circulation of blood, elimination of waste, contraction of muscle mass, and things like that. But during this particular process of energy development, we accumulate free radicals, which give rise to metabolic stress. And if they are in excess, they bring about damage to the body and early aging. So metabolizing food creates stress in the human body. And when we overeat, which we normally do, more stress on the human body is produced. And this leads to shorter lifespan and the serious health problems. And we all know that cardiovascular disease and type 2 diabetes has become a big epidemic because of overeating and obesity. A lot of research is on while metabolism shortening has been linked to aging process, but it is still, scientists are not clear whether the shorter metabolisms are just a sign of aging, like gray hair, or actually contributes to aging. Still, a lot of work is going on all over the world to confirm the role of metabolism in aging. We all know that the free radical damage almost every organ of the body and precipitates diseases. These are the diseases which can be summed up because of the aging process, and it affects every organ of the body from the top to the toe. Neurodegenerative diseases like Alzheimer and dementias affect a lot of old age people to the tune of almost 30% beyond the age 85, and these are very debilitating. Metabolic disorders, again, caused by obesity and liver cell function, have brought an epidemic, and this decreases lifespan of an individual in a big way. Degenerative bone joints cripple the individuals whenever they are infected as a result of the same. As for the epigenetics is concerned, as I just now said, that 80% our aging is affected by our environment and our lifestyles. And there are 9 hallmarks to aging as for the epigenetics are concerned, and can be a separate big talk on this, which I'm not going to dwell upon it. But the positive facts about epigenetics on aging are that the world will have more people who live to see their 80s and 90s than ever before. And it is expected by 2050, the number of the people who stay beyond 80 or 90 years is going to increase 4 times than what it is there today. And more children will know their grandparents, especially the great-grandparents, especially their great-grandmothers, because on an average, the woman lives 6 to 8 years longer than the men. As for the negative effects of epigenetics on aging is concerned, worldwide, there are going to be dramatic increase in the number of dementia and Alzheimer's disease, which is also called type 3 diabetes. And as I had said earlier, that nearly 30% of the people beyond 85 or older have some degree of the cognitive decline. Anti-aging research refers exclusively to slowing, preventing, or reversing the aging process. I can give that these are the 10 ways to transform your health. If you want to age gracefully and slowly, you need to talk to the aging expert and take their opinion. Assessment of damage because of the aging is possible these days, but there are not many takers today. You have to bring about attitudinal change of giving and sharing and cooperation. On a daily basis, you need to de-stress yourself and recharge yourself. People talk these days too much about detoxification, and because in Ayurveda, there is definite term or procedure that is panchkarma is being used often to detoxify your body so the diseases do not emerge. Pranayam and various drinks are available for detoxifying. And simple is, warm water early morning to be taken. We are not taught about nutrition and the diet during our 4 walls of the medical college. And WHO emphasizes that each doctor should know in detail about the nutrition and give dietary advice to every individual they see. It is very important. In case if they fail to do that, dietitians are soon going to replace the doctors. Supplements like antioxidants and bioidentical hormone replacement therapy are getting popular. And the nutritional aspect is that, calorie restrictions in a big way is desired because we eat too much. Exercise have a definite place. And coming to the last, which is the most important, one should use autologous stem cell therapy. And this can definitely repair and rejuvenate you completely if taken in the right time from a good center. Now, this slide again summarizes what I have just now said, that if you are looking for an optimal health, your upper story has to be normal. That is, your mental and spiritual well-being should be absolutely great. That includes a daily meditation, and you've got to have a purpose of life. Social activeness is also very important along with the positive thinking. Physical health and the fitness is very, very important, which is brought about by detoxification regularly and eating a nutritious diet in a small amount, having a good sleep. And if you are bothered about the looks, now there is a cosmetic and aesthetic surgeries are available, which you can definitely liberally can make use of it. These are the ones which can definitely delay your aging process. But this has to be coupled by stem cell therapy because this we find in a very big way does repair of your body if you're taken around at the age of 50 years. As for the assessment, is possible. Now the various tests are available, but because they are expensive, there are not many takers as far as our country is concerned. When we see the celebrities, they take it very sincerely because they are bothered about their looks and their vitality and enthusiasm and motivation, that they follow things very regularly along with stem cells taken. They use cell-based therapies for a body shaping, which is given by the cosmetic and aesthetic experts, along with marked calorie restrictions and supplementation like antioxidant BHRT. Trans fat are doing a lot of harm, and I think a public awareness is required about them because they cause chronic inflammation in the body, which accelerates the aging process. It's a fact that we Indians eat too much and too often, and that causes a lot of stress, and calorie restriction need to be brought about. There are 2 streams. One is age-old thing that, intermittent fasting, which has been going on in our country for a long time. And many other religions also follow the same. And the other one is, you take a dietitian help to cut down your calories markedly, and what quality of food you should take to supplement with a good nutritious diet you need to take. Now, this is what the intermittent fasting is done in various ways. The most common one is 16 hours fasting and 8 hours window when you eat. One has to practice is to discover the secrets of gradual aging, great weight loss, and a long life as a result of intermittent fasting. I find these are the two gurus in the city of Delhi, which in their small way are trying to propagate this particular thing by themselves being the role model for the same. Many experts like me advocate plant stem cells technology to speed up cellular regeneration. For longevity, it is absolutely great, and wherever the berry shrub is attached, it is very good antioxidants. Antioxidant supplementations are required to protect almost every important organ of the body, and it is really required. And these are a bit expensive, and I think the doctors have to get used to prescribing them for their patients as well as take themselves too. A word about the HRT and the BHRT. We all know that the risks associated with the conventional HRT are great, and that's why it has put their use in question because of slight increase in breast cancer, coronary heart disease, or stroke. The choices have changed to natural alternatives, which are in the form of phytoestrogens, which is given in the form of isoflavones and ligands, and there are other things which are popular like Siberian rhubarb, black cohosh, and cruciferous vegetables, which we all use, broccoli and cabbage. Evidence definitely is lacking, but the millions are taking. That means it must be doing something good to it. So evidence is not all that which is important. As far as BHRT is concerned, bioidentical hormone replacement therapy, there's enough evidence demonstrating the superiority of bioidentical hormones over conventional HRT, and these are available in the form of FDA-approved preparations, which are oral, transdermal, and vaginal route. Still not very popular in India, but मैंने बाहर देखा है लोग थोक में इनको खाते हैं. And a fistful of tablets they take on every day, and they feel that it gives them a feel-good factor. It increases their productivity and they improves their mental acuity. We all aware about it that the new age techniques, how to look beautiful. We know that various kind of facials have come up, and then peeling of the things of propolis along with the microdermabrasion, which are getting popular every day, and the people are getting hooked to it. But we all know that to look beautiful has been age-old thing going on. Queen Victoria was very fond of using various kind of serums and for her glowing face and glowing skin. Retinol creams are currently being used by the youngsters to look good in spite of them knowing that they have a teratogenic effect. Sheep placenta facials, PRP facials, all that things are mushrooming and getting popular. Coming to the stem cell therapy in regenerative medicine for anti-aging, we all know that stem cells can develop into nearly any kind of cell, and they have an infinite number of cell divisions and making them almost immortal. They restore the function of the various organs wherever functions have gone wrong, and finally the stem cells and the regenerative medicine use puts back the clock of human aging to some extent. We all know that stem cells is a genetic cell that make exact copies of itself indefinitely, whether it is identical stem cells or specialized cells. Use of stem cells have been highlighted nearly in 80 diseases by the National Institute of Health. Many modern doctors say that the evidence is lacking, but that evidence will take quite some time. As per the government of India is concerned, it permits autologous adult stem cells for its use. And again, I find, there are not many takers for the same. And it is, we can say that, these are the people who have been ambassadors of stem cell therapy and propagate the changes in the lifestyles, like, curtailing calories and doing exercise and having a positive frame of mind to serve the society. Here, I will say that if you take little earlier than 50 years, the effect will be much better, as you can see on my two colleagues who have been working with me for the last 32 years with me. I very emphatically say you have to use it to believe it. Both myself and my partner feel 10 years younger. Your experience will be your experience once you use it. They are great booster as far as gaining an optimal health is concerned, and it gives you a feel-good factor for improving your mental equity and increasing your productivity. Still, the role of telomerase in anti-aging is under study all over the world, but I think in the next 5-10 years, final answer is going to come. Long telomeres are associated with long life. I'm a very strong proponent of holistic approach, that the 6 components are there, that you cut down, normalize your weight, calorie cut, yoga, exercise, meditation, good sleep, and saying big no to smoking and alcohol. And you need to recharge yourself with stress management techniques. It's always good to start your lifestyle changes rather early to reap at the ripe age. These are just 10 minutes exercise schedule, and I think if it is done, it can keep you absolutely fit. Stress management is required to recharge your battery every day, whether you do it by singing or by doing gardening or reading some books or getting, maintaining a relation. The extra phone calls probably will do you good and recharge yourself completely so you're fit for another day. Meditation is the biggest stress buster, and I was asking my daughter, who's a psychiatrist, can medication help to relieve stress? And she feels that holistic approach is far, far better than medication. Total body rejuvenation, or what is called 360 approach, is a big business these days, and which is given in the form of body rejuvenation spa, where right from the stem cell therapy to bioinjectables, energy-based devices, your Ayurvedic massage, yoga, nutrition, and antioxidant supplementations are being talked about. So, coming to my last slide, if you're serious about anti-aging, sleep is the best medication, says by Honorable Dalai Lama, and you need to be a good person from heart and willing longevity. Less is said about the stem cell therapy. I'm a great proponent and ambassador of stem cell therapy, as well as the people who want to look good. I feel that your skin is a big investment. It is not an expense. And instead of spending money on expensive holidays, it's good to spend some amount of money for yourself and forget about it and see its results a decade later. And it's good to read a couple of books also that, which will keep you on the right track and give you a positive thinking. So I started with a question, is graceful aging possible? And I can say, yes, it is possible, provided you change your lifestyles and normalize your weight and take stem cell therapy autologous, preferably before 50 years. Thank you very much. Malti? अच्छा, कितना टाइम लगा? तो मैं तो 20 मिनट में खत्म करना था, तो ये 25 मिनट में कैसे हो? तो देख तो सही कहाँ पर रह गया है बेटा? है इसका मतलब मैंने तो अभी बहुत कम कर दिया, अब क्या कम करूँ? और
तो ठीक है मैडम।